Hello everyone and welcome to our channel Med Study. Today in this video we are going to learn in detail about each and every vaccine, which is a very important aspect in practical pediatrics. So let's get started. So we'll be discussing vaccines under age at which they are given, dose, route of administration and site of administration. So first is BCG. It is given at birth in dose of 0.1 ml. It is given intradermally and in the left upper arm. Hepatitis B is given at birth in the dose of 0.5 ml. It is given intramuscularly on the anterolateral aspect of mid-thigh. OPV, it is given at birth, 2 drops orally. OPV 1, 2 and 3, which are given on 6, 10 and 14 weeks respectively. It is also given 2 drops orally. Now coming to rotavirus, it is given on 6, 10 and 14 weeks. 5 drops are given orally. IPV, that is injectable polio vaccine, it is given on 14 weeks, 0.5 ml and is given intramuscularly on the anterolateral aspect of mid-thigh. Penta 1, 2 and 3 are given on 6, 10 and 14 weeks respectively in the dose of 0.5 ml intramuscularly on anterolateral aspect of mid-thigh. Measles first dose is given in 9 to 12 months, 0.5 ml subcutaneously on the anterolateral aspect of mid-thigh. Japanese encephalitis 1 is given on 9 to 12 months in the dose of 0.5 ml subcutaneously on the anterolateral aspect of mid-thigh. Vitamin A is given between 9 to 12 months, dose is 1 ml and is given orally. DPT booster is given on 16 to 24 months, dose is 0.5 ml, it is given intramuscularly on anterolateral aspect of mid-thigh. OPV booster is given between 16 to 24 months, 2 drops are given orally. MMR is given between 16 to 24 months, 0.5 ml subcutaneously on the anterolateral aspect of thigh. Japanese encephalitis second dose is given on 16 to 24 months, 0.5 ml subcutaneously on the anterolateral aspect of mid-thigh. Vitamin A second dose till 9th dose are given on 16 months and then 1 dose every 6 months. It is given in the dose of 2 ml orally. DPT booster is given between 5 to 6 years of age. Dose is 0.5 ml and it is given intramuscularly on the anterolateral aspect of mid-thigh. Tetanus toxoid is given on 10 and 16 years, 0.5 ml intramuscularly on the anterolateral aspect of mid-thigh. So this is the BCG vaccine. This is hepatitis B vaccine. This is oral polio vaccine. This is a rotavirus vaccine. This is injectable polio vaccine. This is pentavalent vaccine, which includes DPT, DTP, hepatitis B and Haemophilus type B conjugate vaccine. This is MMR vaccine, measles, mumps and rubella vaccine. This is Japanese encephalitis vaccine. This is vitamin A solution form. This is again MMR vaccine. This is tetanus toxoid vaccine. So now finally coming to vaccine vial monitor. Here, if the inner square is lighter than the outer square, then use the vaccine if expiry date has not been passed. At later time, if the inner square is lighter than outer circle, if expiry date has not been passed, use the vaccine. Now discard point is when the inner square matches the color of outer circle. Do not use the vaccine and inform your supervisor. Beyond the discard point is when the inner square is darker than the outer circle. So here you do not use the vaccine and inform your supervisor. So this concludes with our session on vaccines. I hope you liked the video. Please do like, share and subscribe to our channel. And don't forget to press the bell icon so that you will never miss an update. Thank you.